This conference will now be recorded.
Hello and welcome, my friend, to the module, the sexual and reproductive health. Okay, so this module is very important. As we all know, my friend, that sexual and reproductive health have a very specific, structure in the NHS. And also, it's a topic that can have some safeguarding issues, can have some safety issues, okay, that um, need to be touched and need to be tested, okay, in the exam. So for you, if you are working in the UK, so you do really understand how the process is going, okay? But if you don't, then you will think that it's a bit difficult for you, sometimes tricky to understand what's required and what's not required, and what is the point that would be considered a very big safety issues. Okay, so if it is a big safety issue, then you never miss it in the exam. Okay, so my friends, now we will have the introduction with the most important topics that we face in the exam. We have some topics like the sexual assault. We will have some topics like the um, vaginismus or the dyspareunia or the vulvodynia, which is considered as sexual disorder, psychosexual disorder. Okay, so um, let's have a look, okay, of what kind of cases or tasks that can have in that you can have in your practice. Okay, after that, we after we have some training, okay, on a very famous recalls, that we can have after that a book discussion. Are you ready? Okay, that's good. Okay, so anybody would like to would like to present today, please let me know. So I do really understand that some of you are busy, some of you may be at work at the moment, but they listen to the session, so we do really understand the different situation. Okay. Okay, so who's my first presenter, please? Okay, so Dr. Mariam, are you ready? Then we have Dr. Tasrina, then we have Dr. Nasreen. Thank you very much, guys. Okay. Okay, so Dr. Tasrina, if you're ready, come on.
Assalamu alaikum, Dr. Rava.
Yes, I'm here, Dr. Rama.
Wa alaikum assalam wa rahmatullahi wa barakatuh. How are you, Dr. Tasrina? How are you?
Yeah, Alhamdulillah. How are you?
I'm fine. So, my dear friend, this is your first task today, and it's a simulated patient task, as you can see. Okay, so you will have 2 minutes trying to elaborate how you approach the case. Okay, and then we will start your 10 minutes. I will prepare myself for the feedback. Okay, and recording all the point. Okay, dear. So whenever you're ready, please let me know. Okay.
Okay. Dr. Abba, I'm ready.
Okay, so your 10 minutes started.
Hi, I'm Dr. Tasrina, one of the doctor in this clinic today. May I just confirm your name and age, please?
Yeah, this is Kelly White, and I'm 21.
Is it okay if I call you Kelly?
Yeah,
Kelly, I am aware of the unfortunate event that you have been through. I'm really sorry that we are meeting in a very difficult time. Is it okay if I ask you some questions? No?
yeah, okay.
Okay. Kelly, how are you coping after that event?
I'm alive.
Oh, I can understand your mental situation, Kelly. And whatever happened, we are here to support you in this journey. And do you feel safe here, Kelly?
No, how can I feel safe after such horrible event?
Okay. Have you informed anyone in the family or any friends?
No, no, I wouldn't speak about
Okay.
something like this.
Okay. Do you want me to involve the police?
No, please don't. Uh, I made it clear when I visited the
Mhm.
sexual center, and I said that I don't want the police to be involved with.
Okay. So did they collected any sample from your body?
Yeah, they have done some test for me.
Okay. Okay. Kelly, so can you tell me actually what happened that time?
Yeah,
I know
it's
asking
really
questions are
difficult.
bringing back the bad memories. Yeah.
Yeah, it's I am working in a nightclub, and there was some guys
Mm.
um, who insist for me to share with
Mm.
them some drinks, and then um, I feel dizzy. I feel dizzy, and I couldn't really recognize what's happening. They took me in a car, and then
Okay. Did you
two
know
of
any one
them.
of them?
No, never seen them
Okay.
before, but it was a mistake from the first place that I accepted to take this drink.
Okay. How many people was at that group, or have you noticed whether they were black or white?
Would it make a difference?
Oh, yeah, there are some medical legal issue. Okay. And was there any actual penetration?
Yeah,
Okay.
unfortunately, there was.
Okay. And did they use any condom or anything? Have you noticed that?
No, of course. I told you I wasn't aware of anything.
Okay. Okay. And do you have any injury in your body now?
No, not really. Some bruises here and there, but not really.
Okay. And may I know about your period? Was it regular?
Yes, it is.
When was the last menstrual period?
This was 10 days ago.
Okay. So, may I know about the cycle duration?
Yeah, it comes every 4 weeks or 5 weeks.
Oh, okay. So, I know it's maybe awkward. Do you are you sexually active without this event?
Yeah, I have a boyfriend.
Mm-hmm. Okay. So, do you use any regular contraceptive?
Yeah, I used to use, something from inside. It's called the spermicide
Okay,
and
okay,
and condoms.
okay. Persistent use of condoms is very important for the safe sex, and it can prevent the sexually shared infection. So, have you ever treated for any sexually shared infection?
No, never.
Okay. So, in this cycle, do you have any other episode of unprotected sexual intercourse?
No.
Okay, okay. And so the incident happened 48 hours ago, right?
It is.
Yeah, yeah. And do you have any other medical condition?
Um, no, I don't have. I used to be fit
Okay.
and well.
Any medicine you are taking or any known allergy to anything?
No,
Okay. And in your family, is there any history of any medical problem, like any
no.
clot, asthma, anything like that? Okay. Okay. Kelly, I'm really sorry that what you are going through, and I know I'm really sorry about your mental status. Don't worry, we are here to take care of you, and we are going to arrange some investigation for you. And
What investigation is this?
well, as you said that the SARC already have taken some sample from you, and did they take any swab from down below?
Um, no.
Okay, and Kelly, at first I would like to connect you to the counselor for some psychological support, and there is some association as well. If you talk to them, you will feel better. And as the incident happened 48 hours ago, so we are going to give you some emergency medicines, emergency contraceptive. There are some oral pills and some device which are inserted inside, but as we don't know the whether those people were carrying any sexually shared infection or not, so for you the oral pill will be better. Okay.
And I would like to know if
Hmm.
you think that I'm risk of getting pregnant.
Yeah, as it's your 10th day, uh, so
Oh,
about
oh,
5
great.
out of 100 women can get pregnant with any sexual assault.
Oh, so then I need something to prevent that from happening. I can't be
Mm.
pregnant.
Yeah, yeah, we are giving you some medicine. There are two option. The medicine, one is we call Ela one. Another one is called the uh, mm, another one is called the Levonel. The
And
Levonel, if
how
it's
how
yeah,
effective that?
if the Levonel, if it's taken within 3 days, that means 72 hours, it's more than 85% effective. And the Ela one, if it's taken within 5 days, it's about 96% effective. And
Oh,
they prevent
if
the
there is anything
release of
like,
egg. Yeah.
okay, so you think that
Hmm.
you said
Okay.
something to be inserted, some device. What is the meaning of that?
Yeah, there are some copper device which are inserted through your down below into the womb, and it will prevent any meeting of the egg
Do
with the sperm.
do you mean
Yeah.
that this is a loop? I
Yeah,
heard
this is a
about
loop.
something like that.
Yeah, yeah.
Okay, so how effective is that?
Yeah, it is almost 99% effective if it is taken within 5 days.
So
Okay.
I think that will be better for me because
Okay.
I do really
Hmm,
want the highest chance, to prevent this from happening.
okay. So if we are going to give you this, we will start antibiotic to prevent some sexually shared infection before inserting this. Okay.
Okay,
And
but
again, we are going to check your hepatitis B
I
status and
have
HIV
allergy.
status.
I
Sorry,
have received tablets before, and then I think I'm allergic to it.
which medicine?
This was penicillin. I got sore throat and they give me some
Okay.
tablets, and then I got some rash after it.
Okay, okay, I am keeping the note and we will not use any penicillin for you.
Okay, time.
Yeah.
Thank you.
Okay, no, sorry.
Okay, so tell me, what do you think, Dr. Tasrina?
Yeah, time management was not good. And
Okay,
there were lots of things to say, like the prophylaxis, hepatitis B, HIV, and the chlamydia.
okay. Anything else
Yeah,
that can come
and
to your mind?
the psychological support should be more.
Okay. Your psychological support was fine. However, yeah, your empathy also, you were speaking in an empathetic way and calming, so I think it was okay. So,
But I couldn't manage
I'll
the
tell you.
time. Yeah.
Yeah, if you have to repeat this station again, and it's a recall station, of course, okay?
Yeah.
So you have to practice again this station. So if you have to repeat it again, then I would advise you that you, number one, ask the patient about her concerns and how you can to help her. Okay, after you show your empathy and your understanding, okay, because you might ask yourself in such a station, if the patient have been seen in the SARC already,
Yeah.
okay, that what else could I do for her? Right? You know, in the SARC, they can take samples, they can offer her also emergency contraception sometimes there, right? So you don't know what's missing, okay, and why the patient is presenting to you 48 hours. And your patient, she also didn't want to inform the police. So this is a bit of, a point that we need to comment at it. Okay, so the adult safeguarding issue here, you need to explore more, okay, because it seems like she's living alone, she doesn't want to inform the police, she have a boyfriend, so we need to ask her about the boyfriend. So I would say that asking about the concern and exploring the safeguarding, the adult safeguarding issue here, and make sure that she's safe at home, okay, or she's living in a safe place, this is a priority. Okay, so this is one thing. Another thing, your history was a bit detailed, I think. Okay, so maybe if you speed up in the questions, this will help you avoid any pauses, and also avoid taking extended history, like for example family history. What family history will help you here?
Yeah.
Okay, so you have asked about the history of the event itself, so which is good. You analyze this event, it was a sensitive way in approaching, okay, but you need to know her, if she had any medical problem, you need to know if she had any sexually transmitted disease, especially now, okay, at the moment, okay, if there's any bleeding, any discharge, any funny smell, okay, because she might cause an infection, okay, and she doesn't know about it, okay, and now maybe she presented to you today because she had some abdominal pain, lower abdominal pain, right? Maybe she had some dysuria from the STI she had conducted, right? I know it would take usually more time to present. That's why we arrange the screening for the STI 14 days after the event, usually, okay? But sometimes the patient can have some infection that appeared, okay, after 48 hours, some symptoms. So we need to explore this part, okay? So the late presentation of the patient is different from a patient who just came after sexual assault, okay? Late presentation here means that there was, you know, uh, steps being done to her, okay? But today we need to explore more. That's why your task was to answer the patient concern and to offer the appropriate plan. Okay, the case that came before in the exam, she had some worries. Okay, she doesn't want to inform the police. That's her story. That's because she doesn't want her family to know about something like that. She doesn't know. She doesn't want her colleagues, because she was attending a college and just working part-time in nightclub. Okay, she doesn't want her friends to know. She doesn't want also her sexual partner to know, her boyfriend. So she said that she's avoiding him. Okay, she said that she is busy or something, and she's avoiding him, and she's afraid. She doesn't want him to know because she's afraid of his reaction if he came to know that there is something happened like this to her. Okay, so this is why the adult safeguarding was there. Okay. Okay, so regarding the medical management, what you think in the medical management should we have covered, dear? I know that you're perfect, but you told me about the HIV, yeah? And if you remember, the role player asked you, would it make a difference, black from white? What you say, what you have said? You have said medical legal. You know why we ask about black or white?
Because some people can take some advantages of that.
That's because the prevalence of some disease is higher, okay, in the people comes from black background, especially if they came from outside the UK. So it's not about the ethnicity differences, okay? It's about the HIV risk.
The infections,
Yeah. So this is the infection risk. This is the thing. Okay, dear. So what else you would advise regarding her medical care?
I should ask about whether any swab was taken about for chlamydia, any hepatitis B or HIV prophylaxis was given or not.
Okay, so I would speak, okay, more about the HIV prophylaxis, okay, and I would like to check because she has moved recently to London. She is not a UK citizen, okay, so we don't know what type of the vaccination that she has, so we need to ask her if she had any hepatitis B vaccination or not, okay, and if she is not updated with her vaccine or she can't remember or anything, then we can offer her a testing and dose. Okay, so this is the thing. Okay,
and she asked to give the copper tea. What should be my approach?
your approach was fine, but in the beginning of counseling, avoid that, please, and that you say something you choose for the patient. Don't choose for the patient. Okay, offer her the options, okay, and let her choose, but explain to her if she choose that option the risk. Okay, so if she is at high risk of STI, then you will give her a prophylactic antibiotic, but you will not deny the copper IUCD. And this is in the Took article, right? Okay, so this is what the main point here. Okay, the psychological support with all what's included in it. It was good. Patient safety, so I would say that this is not complete because the HIV prophylaxis and the screening. Emergency contraception that you have said, but you didn't cover. Okay, why? You didn't cover completely because when she choose, okay, that's why making the patient choose or ask the patient about concern will make your task easier in the time management, okay, because it will avoid saying so many things, okay. So when you ask the patient about her preferences for the emergency contraception, then we have the copper coil or we have some tablets which call the after pills, okay. So which one you want to use, or do you have any specific preferences? She will tell you that I want the most effective, okay, something very effective for me, okay. So the very effective, then you have to explain, okay, you have to explain that the copper IUCD was the most effective, yes, and it's 99% effective, but because the risk of infection from that event, so we need to give you an antibiotic cover. Do you have any allergy from any known allergy? Okay, so this is will be the approach. Then you have to tell her that how is the insertion of the copper IUCD and what is the precautions, okay? Like that she expect to have some mild pain, she expect to have some bleeding or spotting, mild bleeding or mild spotting after this. It can make her period heavier and can use it as a reliable form of contraception continuously. And what if failed? Okay, because also this was a question from the role player in the exam, that the role player asked it, what if failed? So what if failed? Then you have to, yes, you have to call your GB and make a urine pregnancy test immediately, okay? And if you found yourself pregnant, then the GB is going to discuss with your options, okay? So this is the things. We will not go into the details of abortion. Okay, so just will tell her that the GB is going to discuss with you your options. Okay, that's it. Okay, my friend, so in the risk of STI, I said the risk with the copper IUCD covering with the antibiotic, then testing, make sure that she knows that she had testing after 12 days because we test after 14 days, and the prophylaxis regarding the HIV, okay, and the hepatitis B is there, and counseling, support, okay, and adult safeguarding issue. This is the thing that we have to explore her background and if she is threatened by somebody or not, okay, with whom she's living and all, okay, and you arrange a follow-up appointment, okay. This follow-up appointment, that's because you know that the vaccination, okay, and the HIV prophylaxis, they have multiple appointments, okay, and this is if her period delayed, this will be for the UPT, and this one we said after the 2 weeks. Okay, dear? Okay, so thank you very much, dear. I would like to invite your friend if you would like, if they would like to share with us their feedback, any question in this part. And by the way, Dr. Tasrina, you are good. Don't worry. Some few things, but you will work on it and you will kick it in the exam, inshallah. Don't worry.
Inshallah. Pray for me.
I'm doing. I do. Okay, guys, any questions so far?
Yeah, early evidence kit, everything would have been collected before itself, ma'am.
Yes, because the early evidence kit, it's called early evidence. So the patient came from SARC, okay? So she is referred already after they have collected some swabs from her and they have collected the early evidence kit. Yes, so we don't need here to do any examination in regards to, you know, trying to explore the injuries or the things or to draw, as you can see here, okay, on the chart, on the body chart. We don't need to take photos or anything. And the early kit, of course, this is if the case came to you immediately after the assault and you are the first person to deal with her, then the early kit is very important. Okay.
Thank you, ma'am.
Yes, you're welcome. Okay. So the point of the pregnancy prevention, okay, for those patients is very important. Guys, please don't deny the copper intrauterine device because it is the most effective. This is based in the TUG article, okay, and it can be given as any case who did not have a sexual assault, but the NOAA's guideline say that we can consider offering antibiotic in the same time, which is a good practice in this case. Otherwise, give her other options like the ulipristal acetate, okay, and of course we will offer the ulipristal before the levonorgestrel because also in terms of the efficacy, higher efficacy, okay. So then the immediate care and follow-up, this patient need the HIV part, okay, the post-exposure prophylaxis, and she can be also offered the accelerated course of hepatitis B vaccine, and she will be offered to referral to the GB or sexual health clinic. However, okay, the patient came already after the SARC to you, okay, so you will write back to her GB. if she agree. Okay, screening 2 to 3 weeks after the assault. Okay, and the Neisseria or the gonorrhea chlamydia trachomatis swab should be taken from the site of assault as well, especially if it is not vaginal only. It can be vaginal or any other site. Okay. For the vulnerable groups, we consider referral to the drug and alcohol service, mental health service, child and adult safeguarding service, or the multi-agency risk assessment conference, the MRCOG. Okay, will be useful if you have a special vulnerable group, like the very famous case of the 9-year-old who got suspected with sexual assault because her herpes presentation to the hospital. Okay, so part of your management is to refer this patient to the multi-agency risk assessment conference, which is the MRCOG. Okay, the ongoing follow-up and support will be by the SARC or referral to the independent sexual violence advisor. Okay, this is the advisor that we speak about. Okay, and there is some organization. It will be nice from you if you remember the name of the organization, especially it's mentioned in your talk article. The organization for the sexual assault is the Rape Crisis, okay, England, or refugee, especially if she is already a refugee in the UK, or she doesn't have a place to live in. So also Women Aid can help, and Survivors Trust and Safe Life. Okay, so remember one of these. This would be good for you in the exam. Okay, that you are aware of the organization that can help the lady in her difficult times. Okay, my friend. Okay. Who's going to present next case, my friends, today?
Can I, ma'am?
Hello, Dr. Deepa, how are you?
I'm fine, ma'am.
Okay, and now we will have this case. 1 second. Just give me a moment to choose a good case for you. Dr. Deepa, are you planning for the February exam?
Yes, ma'am.
Okay, that's good. Perfect. Good luck, my dear.
Thank you, ma'am.
Okay. Your time is started. Okay, and please, whenever you're ready, I'll start your 10 minutes, okay?
Okay, ma'am. Shall I start, ma'am?
Just give me 1 second. I'll start your timer. Yes, please.
Hello, this is Dr. Deepa, one of the doctors in antenatal clinic, obstetric clinic today. May I know your name and age, please?
Yes, doctor. This is Lisa John, and I'm 29 years.
How do you like to be called?
Lisa is fine.
Okay, Lisa, I can see from your notes that you are 8 weeks into your pregnancy and you have come to discuss your booking blood investigations, right?
Yeah, I had last week some blood sample tests. They did it for me, but yesterday the midwife called me and she said I have to come to the hospital and see the doctor to discuss some concerning result. So I'm
Okay.
just wonder what it is.
Okay, so is it okay if I ask you some questions, then discuss your report later?
Yeah, sure.
Okay. So can you tell me more about this pregnancy, Lisa?
Yeah, it's okay. It's fine. It is my first time, and
Okay.
I have some sickness, morning sickness, but it's okay.
Okay. Was this a planned pregnancy?
Yeah.
Okay. 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 So so how were your cycles regular?
Yes, it is.
Okay. So I just want to reassure that whatever we discuss here will be confidential, and I may have to ask you some personal or intrusive questions also. Okay.
Okay.
Okay, so how is your um, so do you have at any point of time you or your partner have been treated with sexually shared infection in the past?
No, I don't have any like this.
Okay, at any point of time, pardon me to ask, so you have more than one partner?
No, I'm seeing my partner since 3 years. We are together, and before I just had one friend at the time of college.
Okay, okay. So so have you received any sort of blood transfusion in the past? Any blood products you have received?
No,
Do you do any like any tattooing or something like that? No?
no,
Okay. So, um, have you, uh, so, sorry to ask, what do you do for a living, Lisa?
I'm working in a library, a public
Okay,
library.
at any point of time, have you ever been abused or forced to have
Oh, no,
intercourse?
no, no, nothing
Okay,
like
okay,
that. You asking this?
okay, okay. So are you allergic to any medications?
No,
Okay. So, do you know your blood group?
no. I think if they
Uh,
do me, they will test it.
okay. Any reservation for transfusion if needed?
Blood transfusion?
Yes.
Why? Why would I have? No,
Okay. Okay. So, do you visit your GP for any medical conditions?
no. I used to be fit and healthy. No.
Okay. Any surgery in your tummy or down below?
Yeah, they removed my appendix when I was a child.
Okay. So, are you aware of your weight height ratio?
I think yeah, it's 21.
Okay. So, how is the support at home?
It's fine. I'm living with my partner and we are happy together.
Okay. Have you felt down or depressed in this couple of weeks?
No,
Okay. Thank you. So, how is your general health? Any cough or any diarrhea? Any weight loss recently? Have you noticed anything like that?
no, no. I'm perfectly healthy.
Okay. And your partner?
Yeah, he's good.
Okay. Thank you for sharing all this information, Lisa. So now coming, do you want to add anything on it?
No, thank you.
Okay. So now coming to your concerns, I see you are here alone. So do you want have anybody discuss your this report with you?
No, I told you. Midwife told me that I have to meet the doctor.
Okay. So do you want anybody to be with you, or shall I tell Manoj to be with you?
No, I'm fine. Please tell me what is it.
Uh, okay, Lisa, I confirm your name, age, NHS number, and this report belongs to you. And I'm really sorry to say that I don't have really good concerning news for you. Uh, This report shows that your blood has tested for the HIV virus.
Oh my God, HIV. Is that AIDS?
Yeah, yes, Lisa, I'm really too sorry. I'm really sorry to say that this blood report shows that you are having this condition.
Oh my God, are you sure?
Uh, most of the time, Lisa, this test is being done, and I will just make sure. So, what type of test is it? And we may have to do some repeat test, which is more confirmatory, that may be needed in some cases. So, I just want to go through it. Okay. But as this report has come positive in most of the case, it will come. It is positive, and only in few cases we may have to do another test to confirm it. Okay.
Okay, so
Uh,
I
so
heard that this disease comes to people who use drugs or needles and something like that. How did I get that?
Yes, Lisa, in most of the cases, there can be many reasons, like this is a viral infection which usually gets transferred by some sexually shared infection, or any time you have any blood received before, or any needle searing, or probably you had undergone some surgery, and at that time maybe there can have be the chances. Are
Do
you
you
with
think
me,
that the
Lisa?
hospital? Do you think that the hospital was giving me this infection?
Actually, I'm not in a state to say actually what were the circumstances at that time, but there can be the chances, and sometimes chances can be there.
Oh my God, then I have to find a lawyer to find out what happened to me. How did they give me this infection?
Yes, yes, we may have to investigate into it, and we can investigate into this matter if you really want to. But there can be many reasons, like any having the contact with the infected person, or needle searing. So these are the possibilities. Okay.
Okay, so I never had something like that, and I
Mm,
only have sex with my partner, and we are together
mm.
for 3 years. So you think that he gave me this?
Lisa, for this, your partner also needs to get tested, and so if you wish, you can tell this to him, or if you don't want, then he will be contacted through the sexual health clinic, and because his health is also important, we get to know about that. Okay.
Okay, but I want to know from where can I got that? So that's mean that he is cheating on me?
Actually, we are not quite sure, like from where you have got this, but only after testing him and going through it, we can get to know about it. Okay, Lisa. It's very important that his status should also be known to us for his safety as well. Okay.
Okay, time is up. Thank you.
Uh, thank you, ma'am. But there are many things to tell.
Yes, of course.
Uh,
But we have to stick to the time, because otherwise, if you every time when you are doing a practice exceed the time, okay, you will not be able to
okay, ma'am.
manage this in the exam. So I'm sorry, whatever the thing that missed, we can discuss it, no problem. But we have to stick to the time. Okay, so it's a very important part in your training, and don't ever underestimate the time management. It can be the cause of failure to many perfect candidates in the exam, unfortunately. Okay, so it's something that we
Okay, ma'am.
have to stick to it, and every time we do the 10 minutes practice exactly, okay? And this will help us in the exam, otherwise your brain cannot recognize what is the time frame of 10 minutes. Okay,
Okay.
dear. So I would like to hear your own comment. Okay, so tell me, please.
Actually, so I gave more time on information gathering, ma'am, and and maybe like all the history I was taking, and that may be quite. That is the reason that I couldn't go to the clinical management and applied clinical knowledge, which is totally left out. And this question, so like from where did she get, as you were asking, so what are the chances that from where she may have acquired? So on explaining these things only, like most of the time I spent.
Okay, so I know it's in this station because it's full of information that you need to explain. Plus, also you are managing a breaking bad news, so the patient will be like in a shock status, and which is expected, right? That the patient will come into shock, the patient will come into asking some questions, and we would like to know what is her concerns to answer it. So we got the answer. So you get the markings exam. So your task is written there to please take relevant history and discuss with her the implication of that diagnosis, right? So the implication of the diagnosis is a very important part, which is you never touched. So you had
Yes.
half of your station only. And even in the half of your station, it was written relevant history. So we will not deal with this case as a routine antenatal care. Okay, we will deal with this case as a high risk case with HIV infection. So some questions like if you have sexually uh, shared infection before, some questions about her general status as you asked her, okay, and if she had any medical problems, if she had any blood transfusion, okay, and especially if she's a UK person, okay, so that's mean that blood transfusion inside the UK or operation inside in the UK is very low risk, very, very, very low risk, okay, to have an infection. So we can ask her if she had received a treatment outside the UK, and a lot of people they do, especially in the cosmetic things, and also they can travel to have a treatment like that and came back. Okay, so this is something we would like to ask. Otherwise, dental worker in the UK usually safe. Operation in the UK is safe. Okay, and the blood, of course, is safe. Okay, so those some question that's very important. Asking about the partner and asking if she's in a stable relationship, and you have signpost and to ask her if she have seen somebody else. Uh, uh, you know. Uh, Somebody is different from her partner means that she had multiple sexual partners. So you have touched this as well. Okay, all of these are relevant questions. I can't really say anything in this. But when we ask about the regularity, the period, how the period, or about the blood transfusion, if she had any reservation for blood transfusion, if we ask about the blood group, okay, would that make any difference for you?
No, ma'am.
No, right? So you could have finished your history in half of the time, okay, by just
Okay.
asking or focusing on the relevant information that you already covered, okay, but along with the relevant information you asked some unnecessary information for this station, okay. So please just
Okay.
filter your the question that you use or the history taking, so you will manage the time. This is one thing. Another thing, in your breaking news, this is HIV case, right? So in the HIV case, she's already aware that there is some concerning result, right? Okay, so
Yes, ma'am.
make sure of here the confidentiality of the patient. Okay, it's a sensitive issue, so we don't in the HIV we don't invite somebody to attend. Okay, so we
Yes,
in
ma'am.
cancer we invite, for example. Okay, but in IUFD we invite, but in a case like HIV, please don't. Okay, because it's a very
Yes, ma'am.
sensitive information and she might doesn't want to share it with somebody. Okay, at the moment. So you have to reassure her of the confidentiality, as you said, is maintained, and you discuss with her the report by saying that you have some concerning, I'm so sorry that the report have some concerning news for you, okay, or some difficult news for you. It shows that the test that you've been tested positive for the HIV. Okay, so here
Yes.
you can have a pause, okay, and then wait for her next question. Usually the role player will come up with a next question, okay. If she didn't, then you ask her about her, if she is okay. I'm so sorry that it must be difficult for you, okay, so I'll just know what is the background, your background, or what do you know about the HIV. Okay, so the patient told you, is it AIDS? And you said yes. Is HIV is the same as AIDS?
No, ma'am.
No, they are not the same at all. Okay, so you have to answer her the correct answer, that they are not the same. Okay, and nowadays there is a lot of medications that can be offered which help people with the HIV till they get very low number of viruses in their body. Some of them may maybe clear the virus completely. Okay, but to be adherent to the treatment, okay, that advised by the specialist. Okay, we're going to deal with your case or deal with you in a multidisciplinary team, or a special group of doctors going to help you in that. So there is a specialist in the HIV, okay, and along also with a consultant in obstetrician, because the patient is pregnant. Okay, and
Yes, ma'am.
from here, you have to give her information about the implication of this diagnosis on her health and on the fetus health. Okay, so for her own health, since she is a low risk case, I mean low risk medically, no medical comorbidities. Okay, so she will be tested further. And the test is not for confirmation of HIV. Usually, they will not call somebody to tell him or tell her, sorry, that you have HIV positive without reconfirmation in the lab. Okay, it's a blood test, and they will do a proper testing, okay, before they come with such result. So, but they will do further testing for the substrain, okay, of the HIV virus. They will take also further testing for the viral load, for the CD4 count, okay. So other blood test will be taken from here. So this, based on that, okay, the treatment or her status will be determined, okay. Because she is pregnant, she need to receive a special combination of medication, okay, antiviral medications, okay. This is to reduce the risk of transmission of this virus from her to the baby, to unborn child, okay. And you have also to tell her that the risk of transmission is low throughout the pregnancy, and by you adherent to the medication, this is will minimize the risk to less than 1 in 100, okay. But the highest risk will be at the time of delivery. So with the follow-up, okay, and when you got advanced in your pregnancy, okay, we will have further meeting with you to discuss what is your options for delivery, okay, and after
Okay.
delivery care. Okay, so from now, your main thing is to reassure that the patient understand the diagnosis, the patient had accepted the news, or she know the information, the correct information about this, okay. And the patient understand that she needed treatment and she need a follow-up, and she need also to understand that this is all will be under confidentiality. When we come to the partner testing, is a very important part also, okay, that we need to test the partner, okay. We will not touch the part of he doesn't want to tell her partner, or if he didn't want, then we have to inform him. No, at the moment, just tell her that the partner need to be tested. Okay, so we will know the partner status, okay, and if he had the infection, then he will be treated. Otherwise, if not, then we will discuss how to prevent that. He will receive a prophylaxis, and we discuss how to prevent, passing the infection to him. Okay, so this will depend on the partner. This patient will be referred to the sexual health clinic as well. Okay, why? Because she need to be tested for other sexually transmitted disease, right? And also in the sexual health clinic, they are going to do the partner tracing, right? And also the patient will need written information to be provided to her to get the correct information, and she needs to reassure her that if she would like to have another appointment to discuss further, okay, with your consultant, then you can arrange another appointment for that. Okay.
Okay, ma'am.
Okay, my dear. So time management, I'm sure that if you had the time, you would touch all the important point. Okay, but time management, please make sure that you are having the time management correctly. Okay.
Ma'am, I just want to ask one thing. So, if when she asks that from where did I get this infection, then how are you going to answer, ma'am?
Your answer was fine. So this infection can be transmitted with different ways of transmission. Some of these ways could be the sexual contact. Some of them can be by blood transfusion. Some can be through sharing needles, as you said, okay, or if you have some work like using the catering and all, this can be the source. So I'm not in a position to tell you at the moment. It's too early to find out, okay, how did you get this infection? So I would advise that you continue, or you will start your journey of the treatment as soon as possible, and you are going to meet an HIV specialist, okay, and a special nurse as well to take care of you, and they can have more answer or detailed answer to your questions. Okay, so
Okay,
we
ma'am.
can't say anything. Yes, you are welcome there. We can't really say anything. We can't accuse the partner. We can't say anything about the hospital. Avoid saying that, because if you say that you might get the infection during your appendectomy, okay, that's mean you are putting the hospital in trouble. And of course,
Yes,
in
ma'am.
the NHS, all the instruments are sterilized, so it would be difficult actually if you put yourself in this position.
So, if she asks that, is it sure that the report is sure, then shall we say that we have to reconfirm it, or it's already been tested and reconfirmed? How
No,
can we
I'm
select it?
sorry. I'm sorry. It has been tested. Okay, it's. I've made sure. Okay, that this is your blood test result. Okay, this is not the
Okay.
first test. This is not in the booking test. They don't do the first test. Okay, in the booking test, okay, they do a proper testing once and twice in the lab, and then they come up with the result. But the patient will be required, okay, again, to further testing, okay. This further testing is going to help them to identify the strain and to identify the CD4 count and the viral load and so on, okay. So she will have further testing.
Okay, ma'am.
Okay.
Okay,
So
thank you,
hello,
ma'am.
you are welcome, Dr. Diva. Hello, Dr. Salma. Yes, please ask your
Yes, I
question.
have Yes. Is it just breaking bad news or concerning news?
You can say difficult news. You can say bad news because
Mm-hmm.
I'm sure that HIV is a bad news. Okay. You
Okay.
can say concerning news.
Okay, and the second thing that in the station I should do just encourage her to just to sit with her husband or her partner and to just to tell him, and it will be confidential. But if she can I tell her, or should I tell her that if she will not just tell her husband, or if there is any risk for her husband and insisting just to tell him, just should I tell her that the team may just there is possibility of just breach this confidentiality, or no need to see for to
I'll
tell
tell
her
you
like that?
something here. I'll tell you, see, okay? So it's a non-recall, okay? Non-recall that there is a question in some station of HIV that she is refusing to tell the husband. But when you are in the station, you don't know, right? You don't know at that level. So don't pre-assume something, okay? Just tell
Okay.
her that she need to be referred to the sexual clinic where they are going to invite her partner for testing, okay?
Mm-hmm.
Because his status should be known, okay? Either if he got the infection, will be treated. If he's not, then he will receive a proper prophylaxis. Till here, this is neutral, okay? This is neutral. This is the information that we say to everybody. If she said, I don't want my husband to be informed, or I will not say this to my husband, then we need to ask her, okay, why she doesn't want her husband to know. This is first thing, okay? If she said, I will receive the treatment, but I don't want him to know, otherwise he will he will leave me, or because I love him so much, or something like that, okay? So we need to give her the proper information that this is a type of infection that can threaten his life, and if you love somebody, so you have to protect him, right, and allow him to receive the proper treatment. If she's afraid of the husband, on the other hand, okay, because it's well-known principle that we need to check her safety by this way first, because she might be in a relationship with somebody who is, maybe he is alcoholic person, maybe he is doing some drugs, okay, maybe he will get angry on her, maybe he will beat her when she is pregnant, okay? So then you have to ensure that there is no risk on her life. So she said, I'm so afraid. So now this raises the domestic violence issue, okay? And we don't go and say, we have to breach, okay, their confidentiality. No, then tell her that you have to stay, we have to think about it, okay? And there will be a counselor, okay, who's very well trained on these issues, going to discuss with you, okay, your fears or your concerns, and how to break the news to your partner, or how to inform your partner. If you need our help also, okay, then we can arrange a meeting where you invite your partner and we discuss the result with him, okay? If she said, she looks like, because most of the people will accept it till this point, okay? If she said, no, 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 I don't want him to be informed, it's my decision, this is something private, I will never share it with him. So if she said, after proper counseling from you, that no, I insist it's no, then we say, I'm so sorry, we have an obligation, okay, that no harm to a person, okay? So to do no harm. So this obligation means that we have to inform your partner, unfortunately, to give him the chance to be tested and treated, okay? And I'm so sorry, in this case, we have to breach your confidentiality. So it's escalation, of the situation there. We can't jump to the last point when we're just starting our counseling, right? Because you don't know what type of person you have in your exam. Maybe you have a role player who is very understanding and she is open-minded and she will accept what are you saying. Maybe you have a role player with a hidden agenda of domestic violence, then you have to protect her before anything. Okay, maybe you have a role player with a very strange behavior and she insists to know despite of the information you give her. Okay, so according to the role player, you escalate the situation.
Okay. Thank you.
You are welcome, dear. Okay. My dear friend, I just want to tell you something. In this situation, okay, for such patient of the HIV and she is pregnant, so it looks like a very long gestation, you cannot choose to start with the report if you would like to, okay, because the patient was here because of the report, right? The patient came to you already with a referral from the midwife and she knows beforehand that there is some concerning news. Okay, so if you would like to start with the report, it's not a wrong way, it's fine. Okay, so that will be according to your own way of presentation. So if you are comfortable to discuss with her the report first, then please do it. You know why? Because if you discuss the report with her, this will help you when you ask the question to be targeted question. Okay, so this will be according to your own preferences, my friend. Okay, so the point that I need to tell you, okay, from this station, that you can start with discussion of the result, okay, take the relevant history, start by her current health status, okay, and focus on the HIV risk factors, okay, including the sexual partner, occupation, if she is having unprotected sexual intercourse or not, okay, and the medical history. This medical history is very important. You have to make sure that she is not having symptoms of reduced immunity at the moment, and ask her about the allergy, okay, and the patient will be afterwards, okay, because this is discussion of implication on her health, okay, the patient afterwards will be invited for the smears, so you can just touch this point, okay, in the management, that there will be some change, like you will have your smears annually, okay, and discuss information to the partner, okay, and informing the partner and testing. Of course, we have to give her an advice for consistent use of condom, even if she is under treatment, okay, so she had to continue use a condom for the safe sex practice, okay. Patient, she is pregnant, so we need to tell, but in a short, because of the time management, tell the implication or how her pregnancy journey will be changed because of the diagnosis, okay, and that she should receive treatment, okay, by the second trimester to reduce the risk of transmission to her baby, and also in the future, okay, we are going to sit with her to discuss the delivery plan, okay. So this is the point that we need to cover in this stage. Okay, so my friend, just I would like to ask you, please, okay, for 2 minutes, and then we continue our discussion, okay. Next presenter will be Dr. Nisreen, right? Okay, so Dr. Nisreen, are you ready to the next? Okay, so if Dr. Nisreen is not, yes, I know Dr. Nihal, you are. Okay, everybody, of course, thank you very much. I just, I'm inviting the person
Hello,
who,
can you hear me? Can
yes, Dr.
anybody hear me,
Nisreen.
please?
Yes, Dr.
Yeah,
Nisreen.
I was not audible. I was talking, but nobody hear me. That's why I
Yeah,
log out and I come again.
yeah, okay, you are
Yeah,
welcome. We were waiting. Your friends, they have, um, expressed their uh, desire to present. However, we will, guys, don't worry. We will have a chance. Everybody will have a chance. Okay, so Dr. Nasreen, you are welcome. I just want to ask you for 1 minute. Okay, then I come back to you to resume the station, but please be
yeah,
ready.
okay.
Okay, okay, thank you.
Yes, sure, sure. Okay.
Okay, Dr. Tripti is next, and then Dr. Nihal is next. Okay. Thank
This
you.
conference will now be recorded.
Yes, please start, my dear.
Hello, I'm Dr. Nasreen, the doctor covering the clinic today. May I confirm your name and age, please?
Hello, doctor. This is Asma Salah, and I am 32.
How can I address you?
Asma is fine.
Okay, Asma, I can see that you are here because you want to discuss about sterilization.
Yeah.
Am I right?
Yes, you are. Yes, correct.
Mm-hmm. You have any other concerns from this consultation?
No, I just
Oh,
want to have the sterilization open, and that's it.
yeah. So, Asma, sure, just I've met you for the first time. If you allow me, just want to ask you a few questions. Then we'll discuss about your concerns. Is that okay?
Yeah, sure.
Mm-hmm. May I know the reason behind which you are requesting a reversal?
Yeah, that's I wanted more children. It's my partner. Who- he told me that we should have another boy. That would be better. So there will be 2 boys, 2
Uh-huh. So,
girls.
okay. Um, um, so your last baby was 2 years now?
Yes, my baby is 2 years.
Mhm. All of your kids are good and in a good health?
Yes, they are. Yeah.
Mhm. Okay. I can see that you have delivered all of them by cesarean section. May I know how was your recovery?
It was okay.
Mhm. Okay. Do you have any discharge from down below, Asma?
No, no, I'm fine.
And what about your periods?
My period is fine as well. It come every
When
4
was
weeks,
your?
stay
Mhm.
for 4 days.
Okay, and when was the last one?
This was 3 weeks ago.
Okay, and may I know if you are using any contraception?
Yeah, I've been sterilized. This is the contraception I'm using.
Sorry. Okay, and if you allow me, I just want to ask you some intrusive questions. So I can see that you are with your husband. So do you have any problem with the sex?
No, we don't. We are fine.
And he is generally fit and well, your husband?
Yes, he is.
Hmm. So do you have any medical problem?
No,
I'm sorry, it's written in there. Okay. And are you taking any medications?
no, not at all.
Hmm. Okay. Um, may I know what do you do for a living, Asma?
I'm not working. I'm a housewife.
Okay. And do you have enough support at home?
Yeah, my husband, he is taking care of the house and everything.
Okay, that's good. And do you drink alcohol?
No, it's haram.
Mm, that's good. Um, so, Asma, thanks for sharing this information with me. Regarding your concerns about reversal of sterilization, Asma, actually, I want to tell you that sterilization is meant to be like a permanent method of contraception for the female. But as you change your idea and you want to have another baby, we would just want to check that the other causes that might prevent you from getting pregnant is okay. That means we need to check your ovaries is producing egg every month, and your tubes are sorry, and that you have no any like infection, and also to check about your husband if he's like the semen analysis is good and he's fit and well. Am I clear?
Yes, okay. So when can I have the operation?
Yes, regarding the operation, just want to check actually through the notes of your last cesarean section to know about what they encounter inside the operation, because having also three cesarean section, Asma, will make the reversal of sterilization is a little bit tricky, because with these cesarean sections we might expect adhesion. This is scar information inside your tummy, and while this reversal is supposed to be like by a keyhole surgery, um, this might be difficult, and there might be like a failure of the whole procedure because of this adhesion, if any, and it might be turned to like an open surgery. Um, am I clear?
Uh, okay, yeah.
Yes. And also, another thing we want to know about how the sterilization was performed for you. Like there is certain success rate will be high with certain types of sterilization. If it's ever done by clips or done by cut and stitch, so it's different because with the clips there is a higher risk, a higher chance of success. And also we will check about the length of the tube that's written. If it's written that it's more than 4, so it will be also like a high success. So if you just allow us, we want to check your notes, and we will just check your other blood test and other issues that can concern the pregnancy, and we will sit with you again to discuss about the success rate if you want to go like for a sure operation. Am I making sense?
Yeah, yeah. So
Yes. So
yeah, I
also,
think I remember they have done the time when I have the cesarean section. I believe they have cut the tubes.
they have get it. So in such a case, we might need to do for you. So that's all. Of course, will be after discussing with my consultant. And there is tests like the dye and X-ray to know about the length of the tube. It can be done for you. And also they can check it with the keyhole itself after going inside the operation.
Okay.
But
Will
having also the, Mhm.
Yeah, so you will have me
having
in that. Will you do? I think I liked you so much. Will you be doing my operation, doctor?
actually this operation is supposed to be by the senior. So most probably I will discuss with my consultant and I will offer you appointment with him. And also we might need help of the fertility peoples also.
Okay.
One thing about if you are expecting this procedure to be like on the NHS, so having a kids, actually this operation will not be covered by the NHS. So you have to do it like on its own. your own money.
Oh,
Am I clear? Mm.
yeah. So how about if I want another boy? Because really my husband, he wanted this.
Yeah.
So
Yes. If ever everything goes, yeah. If everything went okay and you have successful operation, then after reversal of the tube, I want to tell you that reversing the tube anatomy will not guarantee that 100% that the function of the tube will return back. I'm so sorry, but still you might not got pregnant as you expect. And if ever pregnancy occur, there is also increased chance that it can be like outside the womb to be an ectopic, what's called ectopic pregnancy. Um,
yeah, but how? What can I do to
mhm.
have a boy?
So other option is that you can have a test tube baby. This is what's IVF. They will take the egg from your ovary and the sperm from your husband, and they will put it together outside. When it will become like a baby, they will return it back to your womb. So
Okay,
this
so
is
so I
another
can have,
option.
yeah, so I can have like this. I can have a boy.
Yes. Yeah. If you want it to be a boy in certain, there
Fine.
is the certain. Sorry.
Okay,
Okay.
it's fine, but you can continue. No problem. I just want to hear this line.
Yeah.
As you can
To
see, you know,
define
Claire asked it so many times about the boy, boy, boy. Yeah.
yes, yes. I just know. Okay. So just to have a boy, to define the gender of the baby, they have to do like what is called pre-implantation genetics. No, sorry. That's sorry, EXI. This EXI is like a special
Okay.
type of a test tube.
Yeah.
Yes.
Yeah. Thank you very much. Thank you. This was the answer I was looking for. Okay. So please tell me, what do you think, Dr. Nasreen?
Oh, what to tell? Actually, many points after I started, I just noticed that I'm out of point. I asked about the medical history. It's written already that she's no medical history. And I
Okay.
asked about contraception. I'm not supposed to ask about it. I just completely followed the template of the history. That's big mistake.
Okay.
And
So
hmm, I'm
apart
not
from the
sure
history,
what did
anything
I do.
else you think it should be covered and you missed?
Yes, I want to tell about the risks of the operation, but I forget the like the bleeding, the infection.
Yeah. So
Mm,
leukemia. Okay. So you know that everything
yeah,
given to you written in the case is for a reason, right? So when the patient,
yeah.
and I'm sorry to say that, but they consider that people came from Asia, from Africa, they could be vulnerable more than to domestic violence and UK persons. However, it's not correct, but anyway, um, you know, this is a
Mm,
stereotyping thing. So she is 32 and she had a choice to have a sterilization 2 years back. So what make her change her point of view? Why she came today? What she told you, this patient?
yes, she told me that she want a boy.
Yes, anything else about the boy? Who really wanted the reversal
Mm,
of the sterilization?
her husband, I think, yeah.
Her partner is pushing her to have a baby.
Mm,
Okay?
uh-huh,
So
okay.
when she told you that my husband, he wants a baby, he wants another boy, okay, then you should
Mm,
do two things. Number one, explore whether this is her wish as well or not, or she is forced for
mhm,
that. Okay, so you ask her, and how about you? Do you think you want another baby?
mm,
Okay, it's very important. Okay, this is one
mhm,
thing.
mm,
Another thing that you have to rule out the domestic violence in this relation. how to ask her the proper question. She is married. She is totally depending on her husband, okay? And she might have an extended family in the UK, maybe not, maybe alone, okay? So we need to ask her the proper question. How to ask this in the adult safeguarding? We ask her, do you feel safe and well supported at home? Okay, so we will not ask, is everything going at home? Or do you have good support at home? This question we ask when a patient who is elderly, for example, okay, who is 77 years old, is going to have a cancer operation. So that means she will need help from members in the family, okay, to like take care of her, or some carer to take care of her. Okay, but for a patient who is 32, we want to rule out the domestic violence. So when we ask, you asked about partners and I was happy. Yes, she's going to do it. Yeah, that she will going to explore the type of relationship with the partner. And if the patient will support it or not, the patient is forced for the decision or not. Okay? So whether or not there is a hidden agenda in this station, you have to dig down in it. Okay? So
Yes.
have to ask the proper question. This is a proper approach. So domestic violence, okay, if there any hidden agenda will come out to the surface. Okay, so please take care. Please take care. Okay, especially that they in the exam, in the 2021 exam, they brought the patient name, like Asian name, okay, and the patient, she had 3 children, all of them are healthy. She had 2 girls, she had 1 boy, and she is coming to ask for sterilization. And look, Maria, when you ask about the sterilization type, please ask it earlier, okay? Like when you ask about the complication of cesarean section, ask her about the sterilization. When did she have the sterilization done? She will tell you it was at the same time. And if it's at the same time, so most probably they have cut the tube, which make it very difficult actually for the sterilization to be done back. Okay, the next point in this station, okay, which makes it very special, is that she keeps saying that she wants a boy. And
Yes.
gender selection in the UK is illegal. Okay, unless it's for medical reason. Okay, so you can only legally choose your baby sex in the UK if you have a serious genetic condition that you risk passing on to your children and only affect one of the 2 sexes. Okay, so only pre-implantation genetic diagnosis has been approved as a technique which does this. Okay, it's a big issue in the legal point that it's not allowed. Okay, so I would like also to share an important, legal document in this regard about sex selection. Okay, and it was also mentioned in one of the recent articles. Okay, so the sex selection, my friends, is done only for medical reasons in the UK. Non-medical reasons is not acceptable. Okay, so even here is the Masterton case. Okay, this is a real story about Alan, Louise. Okay, they have lost a child. Okay, and this was a younger child. The old daughter, Nicole, she is the one. Okay, and then they have 4 sons. Okay, so they wanted to have a gender selection, okay, for family balance. Like they have 4 boys, they want a girl. Okay, so they campaigned for the right to rebuild their family with a daughter because they lost a child. Okay, so what happened is it was not acceptable. Okay, so they have argued the Human Fertilization and Embryology Authority, the HIFA, to allow them to undergo the IVF treatment and select a female embryo using the pre-implantation genetic diagnosis. However, it was refused. Okay, even with explanation of the psychological need for a daughter. Okay, so again, however, the HIFA will only consider an issue of if a clinic applies to them for a license. Okay, so the Mastertones could not find a UK clinic that was prepared to take up the case to their behalf, and so thought treatment in Italy instead. Okay, then, however, only one male embryo was produced, which was donated to an infertile couple. So they had been traveled to Italy for having a girl, okay, but then it came up to be a boy. You know what they have done? They donated the boy to infertile couple. Okay, so this is hello, and we have to deal with it. Okay, so when she asked this question about the boy, okay, so you have to give her the correct information that it's not allowed in the UK. Okay, and the reversal of sterilization is not funded by the UK and by the NHS, and the IVF will not be funded also by the NHS because she had 3 living healthy children. Okay, and the type of sterilization itself makes the cannulation is very difficult. Okay.
Hello.
Hello, Dr. Salma.
Yes, just I have a question.
Yes.
In funding, regarding the funding, I know with the criteria, it will be self-funded. But can I just tell her, we can negotiate with the clinical commission group, or no? Just I need to be straight with her and tell her it will not funded by NHS.
So I'll say, first, please, everybody, make sure that you are muted except Dr. Salma, please. Okay, because there is some echo from here. Okay. There is a lovely child voice as well. Hello, hello, baby. Okay, so the question. Same idea. Every time we say don't escalate or don't presume anything unless it came to the scene. Okay, so the patient, you tell her that this is not funded by the NHS. Okay, if the patient, or this is rarely funded by the NHS, if the patient accepted the information and she didn't comment on that, then it's finished. Okay, maybe she have the good finance and she is secure to do this on her behalf, and this is not the issue. Okay, if the patient insists that she wants this on the NHS and she is not going to have it, like another scenario, this one, okay, I will discuss it with you, Dia, to show you the difference. So one patient will accept the information you give her, one patient will fight, and she will, no, it's my right. Okay, I've been deceived by the doctors. They didn't tell me prior the operation that this is not reversible by the NHS. Okay, if they told me so, I wouldn't consent for the operation. Okay, this is another scenario that came before also in the recall. It was a lawyer, an angry patient, okay, that requesting reversal of sterilization, and they claimed nobody informed her that the reversal procedure is not funded by the NHS. Okay, so in this case, how to finish the station without going into conflict with the patient? In this case, that you are going, okay, to write back to the GB, because the GB will be the one that can help her, okay, and discuss it with the commissioning group. In this regard, it's not something that we solve in the Obs and Gynae clinic.
Okay, thank you so much.
Okay, so you're welcome, dear. So it's two different situations for the scenario of sterilization. Okay, so you have to know which case you are dealing with. Another case also, because he loved the station of sterilization that came, and she had lost her children in accident. Okay, so this one that we can also discuss with her, that yes, this is might be eligible for funding. Okay, so if she asks about this thing because she had no living children. Okay, and we have to tell her the correct information about the sterilization. Okay, my friends, so be ready to all types of scenario. It's only one topic, but it can come with different scenarios, and you never know which type of role player you have unless it came to the scene and the role player discussed the issue with you. Okay, so the reverse of sterilization, basic information that you need to remember, that there is a regret rate, especially if the patient is below 30, as you know, and the regression percent is 5%, okay, and 1% of the patient who had the sterilization will request the reversal. The most common reason is a new relationship, and you need careful preoperative counseling to decrease but not to eliminate the number of requests. So the important point is you have to check what type of sterilization that the patient have. You have to check also that the patient, she doesn't have any other problem with conceiving, either her or her partner, okay, prior to the operation. This is if you are going to discuss the operation itself of the patient. The ethmic to ethmic anastomosis is the most successful method of sterilization reversal, and the results are poorer than the ampulla of damage. And when there is problem also, okay, or disparity of the luminal diameter of the two joint segments, sterilization reversal is rarely funded by the NHS. Literature found, okay, that overall pregnancy rate is 31. In some cases can be successful to be 90%. The recommendation, okay, that it can be done tubal reanastomosis, okay, but there is also high rate of failure if the surgery fail, okay, so then we consider the IVF. The patient need to be aware also of the risk of failure of the operation, risk of ectopic after the operation, okay? And if the patient had a previous 3 cesarean section, so what do you think about the risk, specific risk in her? The operation itself will have higher or added risk to the fibrosis and adhesions, right? And okay, that's what make it very difficult, okay, to be tested. And even if the patient become pregnant, even if she had to choose the IVF and she went through it, then she need to understand the risk of pregnancy after this. So we'll just say you will not discuss the whole repeated cesarean section information. You just discuss with her that the pregnancy, okay, after a 3 cesarean section is going to carry higher risk on you because of the repeated section and because of the afterbirth localization, okay, due to the previous scar. Okay, guys, clear? Okay, so some factors we decide, okay, to take into account if we want to check if the woman is suitable for reversal of sterilization or not. This would be commitment and stability of the relationship. Okay, this there is also welfare of the child assessment, so it means that those family they are safe to have another baby and they don't have any other issues. Fitness for surgery, woman age, fertility decrease with age, of course. Presence of coexisting tubal disease, IVF may be more appropriate, and the presence of other infertility factors like male, for example. So the IVF or ICSI would be more appropriate. Type of the sterilization technique, okay, and of course, if they used a diathermy in her operation, that will make the operation more difficult, and the clefts destroy less. Surgical experience and appropriate facilities, okay, and the success rate actually is related to the method of sterilization and the experience of surgeon. Okay. Are we clear so far?
Rabah, may I ask a question?
Yes,
Yes.
sure. You can ask.
Yeah,
Hello?
so how
Yeah.
far we should talk about the success rate
You just give her the
or no
true
need?
information. The success rate of the operation, okay, vary depending on a lot of circumstances, but it is from 30 to 90%. Okay, so it can be very
Mm-hmm.
low as 30 or can be successful in like some cases they can have 90% chances of success. Okay, so of course of such a patient she had less favorable factors, okay, because of repeated cesarean, because she had already the operation done at the time of cesarean. However, you will say also you can check her notes, but it's apparently clear that if she had a during the cesarean section, so most likely this would be very difficult. Okay, so
Mm-hmm.
patient need to understand this information clearly, because we have to be honest with the patient, right?
Yes. And, yeah.
Okay.
And when you asked me who will do the operation, what did you mean by that question?
I was just trying to remind you that this is not done in the NHS. So you are in the
Okay.
NHS, so you have to say something, okay? And yes, it could
Yeah.
be also must be done by a doctor who had experience in this case, if they decided to. Okay, so you could have, even if the patient show that she can afford doing this operation privately, but she want more information regarding the success rate or her chances or whatever. So in this case, you can tell her, I can arrange an appointment with a fertility specialist to discuss this with you. That's it.
Yeah. So if I fail to make the domestic violence apparent in the station, how far I will be marked, or it will
Okay,
be total
so
failure?
that will depend on the station, the examiner, how he wrote the station. If the examiner wrote the station with a hidden agenda of domestic violence, then you have to deal with domestic violence. If you miss this point, then you ruined the station, the whole station. And if not, it was just a point in the, in the safety of the patient.
Mm-hmm. Point in safety. Okay. Thank
Yeah,
you,
so
Dr. Rawa. Thank you very much.
you are welcome, dear. Okay, so we said Dr. Nihal will be the next, or who's next? I'm sorry. Is it Dr. No, sorry, not Dr. Nihal. Dr. Tripti first, then Dr. Nihal last. Hello? Anybody is ready for the station, guys? Hello, hello.
Hello, ma'am.
Yes, hello, Dr. Tripti. How are you?
I'm fine, ma'am.
Okay, so are you ready?
Yes, ma'am.
Okay, please come on.
First, I will. Okay, I will read the station, ma'am.
Okay, take your 2 minutes, and whenever you are ready to start, please let me know. I'm sorry, Hello, dear. You might need to start already. Your 10 minutes is counting now.
Okay, ma'am.
Okay.
Hello, yes, ma'am. Hello, I'm Dr. Tripti, one of the doctors today in the clinic. May I confirm your name and age, please?
Hello. This is Helen Becker, and I'm 29 years.
How may I call you?
Helen is fine.
Okay, Helen, I have gone through your GP note and I have learned that you have some problem in your vulval area that is down below. Am I correct?
Yeah, doctor, it's correct.
Okay, Helen, do you have any specific concerns and expectations to be addressed in this consultation?
Yeah, it's actually, I want a treatment for this. This is very annoying pain, doctor, and I'm so anxious about it. So I need a
Helen,
treatment, please.
okay, Helen, I'm very sorry to hear about it. I would like to give a management plan to you, and I'm going to to help and support you. But before that, will it be okay if I ask a couple of questions?
Yeah, sure.
Okay, okay, Helen, could you please tell me more about your this pain?
Yeah, it's, I think it's all the time is down there in my private area, and it's very annoying. I have tried so many things for it, but it didn't help.
Okay, could you please tell me what medications have you tried till now?
Yeah,
Anything specific?
yeah, I have tried some antifungal creams from the GP, some also cream steroids, he told me, and they give me some tablets, but I couldn't continue with it because it was make
Mm.
me so tired and sleepy.
Okay, so Helen, could you please tell me, is there any triggering factors for this pain?
What?
Some
Sorry,
any okay, any factors which exacerbate your pain? Anything which
you
makes your
mean the
pain
feel
more worse?
increase?
Worse,
Yeah,
yes, yes,
yeah,
yes.
increase. Yeah. Uh, uh, it's all with there, but sometimes if it's sore more, sometimes I feel burning and stinging in it, especially on touch or if I had
Okay,
the sexual relationship.
okay. So, Helena, some personal intrusive questions I may need to ask. Will it be okay?
Yeah,
Okay. So, have you ever been treated for any sexually said infections before? Any sexually said infections?
no, no,
Okay. So, do you have any vaginal discharge?
um, no, I don't have any.
Okay. And what about water works and bowel habit? Is it normal?
Yeah, it's okay.
Okay. So, could you please tell me more about your the cycle periods? Is there any problem?
No, but just I feel that every time I'm getting my period, I need to use some painkiller because the pain increase in my private area as well.
سريع لان انا قبل اتاخر ده انا ما ارجع الشغل وده
Mm,
اسمع وده.
okay. I'm sorry, Dr. Tripti. Please unmute yourself.
Okay. Okay. So, uh, and so is there any tummy pain? Do you experience any tummy pain?
No, not really.
Mm, okay.
It's mainly in
And
that area if you get my point.
yes. Okay. And any pain while having sexual intercourse with the partner?
Yeah, it's hurt more and the soreness is more. And
Okay.
I'm not in a regular relationship because of that. I'm avoiding having sex because of that.
Okay, I'm very sorry to hear about it, Helen. And any contraception do you use?
Not currently because I'm not sexually active.
Okay. And any medical problems?
No,
Any surgery in the tummy or down below?
no,
Any allergic history?
no, I can't remember any. No.
And are you generally fit and fine? Okay. And do you take alcohol or smoking? And
No, I'm not
okay,
smoking and I'm not taking alcohol. No.
okay. And is your support at home good?
Uh, I'm living by myself. I'm a grown-up girl now, so I'm living myself.
Okay, okay, Helen, thank you for all the informations. With your history, I got to know that you have this condition called vulvodynia.
Yeah, I heard about it. I actually Googled it and found it on the internet. This is what I believe I had.
Okay, do you have any idea about it?
Yeah, it's something like pain all the time in the private
Mm.
areas.
Oh yes, yes, Helen. So there are different causes of this condition, and like sometimes we may not find any cause, and sometimes there is due to the infections, like sexually associated infections. Sometimes it may be due to these things, and also uh, and these are the things. So in your conditions we have to look after the cause of it, but sometimes and there is no cause, we have to treat as you said that you have already taken this antifungals and some medications, that is amitriptyline. It has not made your pain better, there is one.
It's actually I stopped it because it makes me sleepy and tired.
Oh, yes, yes. Okay, Helen. This is one of the side effects of this amitriptyline, and it makes sometimes sleepy, and sometimes there is a dryness of your mouth, and sometimes there's vision problem as well. So, in your case, what I can do is like sometimes this talking therapy is also very beneficial, which we call cognitive behavior therapy. And in your case there are certain general measures which you need to take, like wearing loose cotton clothes, and avoiding the synthetic things, and also avoiding this soaps and bubble baths. They also very can make your this pain a little bit better. Are you following me, Elaine?
Yeah, sure, of course. So
Yeah.
yeah, I make sure that I do this, but I continue on this. But I have tried already, doctor, and it didn't help.
Okay, okay. So another things are you can apply some emollients and aqueous cream, and as you say that there's some problem with your sexual life, so in this case you can use this lubricants before the sex. Also, you can use some lignocaine jelly, and you have to apply in your vagina, and before the penetration, you can wash 20 minutes before the penetrations. Besides that.
But my problem,
Uh,
okay, but my problem is not about the sexual problem. My problem is the
okay,
pain. That's continuous pain.
okay. I'll try to address your pain, Helen, as far as possible. And in these conditions, there are certain medications like this amitriptyline, which you have taken, and others. There is medications called gabapentin, which also helps reduce the pain. But there are certain side effects, like is feeling dizziness in this case, and also, uh, are you
Okay,
getting me?
yes, sure.
Oh, okay. Thank you, Helen. So in this case, the treatment is like either you have other treatment is like like we can give some injection down below, which is called the steroid injections. As you said that you have also applied this ointment before, tried before. If nothing resorts, if every resource fails, the final is the surgery, which is quite rarely helpful as well. So this gabapentin and amitriptyline can be helpful for you besides some the side effects. Okay, Helen.
Okay, but I also have, some search and found that there is a surgery that can help. women who have the
Yes,
same situation as
yes,
me?
this can, yes, surgery can be helpful, but it's not guaranteed that surgery can be helpful.
Okay.
Okay. Uh,
So
do you have any other concerns, Helen?
yeah, yeah, it's actually your time is up. Okay.
Okay.
Uh, okay.
Thank
Yeah.
you, ma'am.
Thank you. Thank you very much, dear. Thank you.
Thank
Okay.
you, ma'am.
Okay. So tell me, what do you think?
Well, actually, ma'am, I think my history was a bit longer, and she has already been to this multiple treatments, and I find no treatment except those gabapentin and surgery. And I also fumbled in the causes of this vulvodynia, and I have no time to offer the pill. That's all, ma'am.
Okay. Okay. So
I,
it's
I, and the main thing is I'm not able to satisfy her concerns. Another thing is that
I'll tell you, dear. Usually, patient with a chronic problems like chronic pain syndrome or chronic sexual dysfunction will not be satisfied easily. Okay, so don't feel like it's too hard. Don't take it hard to yourself. Okay, so a proper counseling is good listening. Okay, yeah, I understand that you are under stress and you want to finish the station on time, and the station had so many things to ask, so that's why you've been like you're trying to rush into the station. Okay, but when it comes to the point of showing empathy to the suffering of the patient or understanding how difficult is it for her, I need you, to have a moment of, a good communication with your patient. Okay, so like this will be appreciated by the role player and will be appreciated by the examiner or lay examiner if they are there. Okay, so the patient had a vulvodynia. Okay, so let's go together through the points to be covered in this. Of course, he made our life easy by revealing the diagnosis of vulvodynia. Otherwise, some candidates find it tricky to differentiate between the provoked vulvodynia or unprovoked, or the vaginismus and the vulvodynia, right? Okay, very common topics in our exam. So simple measures, okay, or simple way to differentiate is vulvodynia is a pain in the vulva, right? It's a chronic pain in the vulva. So if this pain is all the time, okay, but get worse by touch, for example, or sexual intercourse, so this is a vulvodynia, right? Unprovoked vulvodynia. The unprovoked type means that it is there, okay? Getting worse or not, this is another feature of it, but it is there all the time, no specific thing to bring it. Okay, so the unprovoked vulvodynia is characterized by continuous burning, stinging, or soreness of the vulva. The provoked type, we can call it the vestibulodynia, and this is referred to pain experienced when the pressure is applied to the vestibule, okay, which is the entrance of to the vagina, for example, during sex or when inserting tampons. Okay, so we can use the history, the general gynae history, to understand more of the type, like asking how the cycles, okay, and may I ask you, are you using tampons or using the, the pads, okay, sanitary pads? So if the patient tell you that she's not able to insert tampons, okay, however, this is not a vaginismus case. This is also a good question to assess the vaginismus, but the unprovoked vulvodynia also get worse, or she feel pain when she try to insert the tampon. Okay, why it's very important to understand what is the problem in the sexual intercourse, okay, or the sexual dysfunction, because the approach is different, right? So when we have a patient with chronic pain problem, like the vulvodynia, then our management will be like the chronic pain problem. So we will depend on first is avoidance of the triggers. okay, like anything. And then we come to the counseling and the psychological support. We come to the pain modifying agent. We come to the, very important to remember this, if a patient still have a chronic pain, to refer her to the pain clinic. Okay, so what question to be asked? The question to be asked, this is the question, as I told you, aiming to understand the problem that the patient have, the suffering, the impact on her life, the medical history, the current medication, the obstetric history, if she had any systemic system reviews, the psychiatric history as well, social circumstances, current life stressor, and very important point is that our dear friend Tripti missed here. It's the, you know what it is? The sexual abuse history. Okay, so you remember in the chronic pelvic pain, okay, and in the cases of sexual dysfunction, either vulvodynia provoked or unprovoked, okay, we need to ask or to explore the sexual abuse history and the FGM. Okay, so our friend asked about the surgery from down below, okay, which I think this was referring to the FGM, okay, but she didn't explore the part of the history of sexual abuse. So please, guys, this is a very important point in the history. Don't miss it. Then let's have the, you know, examination or the checklist for the physical evaluation and the investigation in the vulvodynia. This will be more helpful for the people who will give the exam face-to-face. Okay, so that's examination will include vulval inspection for abnormal redness, fissures, erosions, ulceration, and hypopigmentation, cotton swab test for determining the area of tenderness and to assess the severity of pain, sensory neurological examination for the hyperesthesia and the allodynia and stroking, okay, for the bulbocavernous reflex and anal wink to rule out peripheral neuropathy. Vaginal examination with minimal application of pressure and narrow speculum, and internal palpation of the pelvic floor muscle for vaginismus or tenderness, and microscopic evaluation of wet smear, vaginal pH, fungal culture, and gram stain to exclude vaginitis. Testing for varicella zoster virus and herpes simplex in the presence of ulcers or vesicular eruption. Dermatologist analyzed vulval biopsy in the presence of sign of vulval dermatosis, like if you have any, if you suspect any lichen sclerosis or lichen simplex, something like this, or some ulcers that suggest that there is a neoplasia, or in the cases of refractory vulvodynia. And refractory vulvodynia, that's mean it's a vulvodynia that's not responding to the treatment, right? Okay, so what investigation we can ask for to make a diagnosis? What do you think is very helpful? We screen for infection, okay, and by wet smear, vaginal pH, fungal and bacterial culture to exclude vulvovaginal infections such as bacteria vaginosis, trichomonas, and candidiasis. Colposcopy, okay, so in a patient who is 29 years, what we need to ask and make sure this is a smear, right? And also we can suggest further examination by the colposcopy to check or to look inside for any hidden lesion as well, or any localized infection. Vulval biopsy, okay, this is not supported as a routine. It's only if you have suspicious lesion or in the refractory cases after she had tried all measures. In the box number 4 in this article, we have overview of the vulvodynia management. Vulvodynia is MDT approach, of course, that tackle the different components of vulvodynia, including lead clinical clinician with clinical psychologist, physiotherapy, psychosexual medicine, and pain management team. So it's very important, my friend, as we do in the cases of maternal medicine, for example, we need to ensure that this patient had a multidisciplinary approach. Okay, This is very important. Again, if you have a structured discussion, this will be important. He will ask about all of this. And in the management, in the clinical management of cases of vulvodynia, make sure that you have made the appropriate referral to the patient. Okay. Women are given adequate explanation of the diagnosis, written information, support group, and contact information. Okay, so this is important in your station as well. Multimodal therapy should be part of the treatment strategy owing to the heterogeneity of the etiology of the condition. That's according to the finding we have. The aim of therapy is to optimize the pain control, enhance psychological and physical well-being, and improve quality of life. That's why the psychological and the pain management teams are very important to help in this case. Okay, the end point of the treatment include reducing the trigger of irritation, blocking the peripheral receptors, okay, central inhibition, tackling pelvic floor dysfunction, and addressing psychosexual dysfunction as well. The first level of treatment, okay, for all subset of vulvodynia is to minimize vulval irritation by vulval care measurement. Topical, local, anesthetic are choice for women with provoked vulvodynia that facilitate penetrative sex. Okay, so it's important for the sex management. But patient with chronic pain, the other medications like the amitriptyline, the tricyclic antidepressants such as the amitriptyline or the nortriptyline are the initial management choice in unprovoked vulvodynia. In the event of intolerance, the anticonvulsant such as gabapentin may be initiated, and our deep Tripty here in this station, she covered this part, so well done. Okay, modified vestibulectomy is an option for refractory localized provoked vulvodynia. So you think that it will be helpful in this patient? No proof that it will help. Okay, and this is a question of the role player in the exam. She wanted surgery. Okay, pelvic floor hypertonicity addressed with pelvic floor exercise and technique to desensitize the pelvic floor muscle. Okay, because the patient because of the chronic pain, okay, they tend to have a hypertone of the muscles, okay, of the pelvis, especially at the time of sexual intercourse. Okay, so pelvic floor muscle exercise can help them. Are we clear so far? Last thing asked by the role player in one of the station in the previous exams is, how about the Viagra? Okay, so I have heard that Viagra can help me, especially in a patient with a problem with mainly her problem is the painful sex. So what would be your answer, Dr. Tripti, for the Viagra, I think? Hello? Okay. It's the mix, there's no enough evidence, okay, to show that it's going to be helpful in the case of unprovoked vulvodynia. However, okay, it showed to be beneficial in some cases, in some other cases, okay? So what is the cases in case if you have this structured discussion? This is in female sexual disorder secondary to spinal cord injury and SSRI use. Okay, so for the exam, we have to say that we're so sorry that there is no enough evidence to support its use, okay, and didn't show the benefit for your case. Okay, my friend?
Yes, Dr. Rava.
Okay, so any questions so far? Okay, thank you, my friends. Okay, so we have been today discussing very important recall cases. Okay, however, just want to apologize that we can't continue more than this because I have another appointment. Okay, So yeah, we will finish up today, but on Saturday we will have another session. Okay, so please attend on time. And for Dr. Islam question, can you repeat the measurement for the patient? Of course, Dr. Islam. Okay, so for the female sexual dysfunction management, okay, that will depend on what is the problem mainly. Okay, so if we have a specific problem, yeah, if she had a specific problem, then we will target treatment of this patient. She is our patient today, Helen, I think. She was unprovoked vulvodynia. For unprovoked vulvodynia, so the first thing is the minimize the irritation, make sure that she is doing that. Okay, the also trying to rule out any other problem, and the antidepressants such as the amitriptyline or the nortriptyline are the initial management choice. If the patient had choose if she had said that she stopped the medication after 5 days only because of tiredness, so we have to explain to her that those medications show the effectiveness, okay, but using medication for 5 days only is not enough, okay, to say if the medication is effective for her case or not. Okay, so she had to continue with the treatment. However, she can try to start with lower dose, okay, and whenever she experience, and then she can, step up after this. And whenever she had experienced side effect of a drug, that means that it start working, and we expect that this side effect will disappear after 1 or 2 weeks of use. Okay, Dr. Islam, so we have to explain to the patient that 5 days is not enough to judge if the drug is working or not. Okay, so we will not just give up the treatment, because this is the important treatment in her case as unprovoked vulvodynia. Then the next, if it is not, like Dr. Tripti, she had told her, if it's not, then it will be the gabapentin may be initiated. Don't forget, guys, the MDT approach of the case and the appropriate referral to the psychosexual, pain management clinic, psychologist, physiotherapy. Okay. Okay, thank you very much for your time, guys, today. So I'll be waiting for you all on this Saturday. And I think that our first presenter should be Dr. Nihal, as we promised. Thank you.
Dr. Rabba, what is the time of meeting on Saturday?
It will be the same time. It's around 11 a.m. GMT. Thank you. Waiting for you all, dear. Bye. We'll continue on recall, important recalls. Thank you.